stop and I would stop, think, and just, and then I'd say something, and then 2 minutes later I'll try to say something about that again, and I forget what,
Okay.
you forget what's going on, and,
Has
stuff
that been
like that.
going on, or that's brand new today?
No, it's been going on.
Okay, I was gonna guess that. I'm like, there's no way this just started right this
It's
second.
been going on.
Yes. Have you guys noticed this? How long has it been going on for?
Quite a while. I don't know. Months, maybe.
Months anyway.
Really?
Maybe more than that.
Okay, was that part of the reason why you were getting this MRI done, you think?
Yeah.
Probably. You have a neurologist, or?
Yes.
Okay.
It's oh gosh.
We've been having some memory stuff too, probably.
Yeah.
Yeah. I'm looking at daughter on that one. Daughter. What's your name? I'm sorry, I didn't catch
I'm
your
Donna.
name.
I'm Donna. I don't know a lot about her doctor's names or any
No,
of that
that's okay. I was
stuff.
asking about, have you noticed her memory kind of being more of an issue lately? Okay, because it's hard to ask someone else that's actually
Yeah.
experiencing that.
Right. Yeah.
Sometimes you're not
Yeah.
always in tune to knowing if that's really happening,
Yeah.
you know?
Yeah.
Okay, but you guys have noticed that, and that's part of what's been going on. Okay, has there been some talks of concern for like dementia and stuff? Okay, I'm gathering all that really quick. Okay. Been falling at home?
Yeah, it's a lot.
Yeah.
Quite often.
Okay.
I've fallen.
Okay. And how old are you now? I
I'm
think I know.
78
70?
June.
Yep.
Okay.
78
Yep.
in June.
Okay, do you know where you are right now?
Yeah.
I'm asking some silly questions.
Where you at?
Where?
West Florida Hospital.
Okay, I was just trying to show
Far
off.
away.
Okay. What year is it?
What year is it? It's 26.
Okay. Okay. Now you really are showing up. All right. Do you know who the president is? Do you pay attention?
Trump.
Okay. As long as she's just showing off. I'll show you. I remember some stuff. Good. All right. So it sounds like here and there you're having some, memory lapses.
Yeah.
Having to think through what you're
Yes.
talking about, maybe a little bit more than usual.
Yes.
This has kind of been going on for the past few months.
Yes.
Sorry, what's it?
Maybe 6 months, maybe even
Okay, and
longer
it's
than
kind of
that.
progressively maybe getting a little bit worse. You're falling with a neurologist. Is that neurologist located next door at the medical center clinic? Do you know?
He is, yes. I'm
Is
trying
it
to
Dr.
think of
Raw?
his name.
Raw?
Huh?
Is it Raw?
No.
No? Okay, I don't know the ones up over there. I know a few on the outside, but they're in this building right next door, attached to us.
Yeah.
Okay, maybe we can look up what the other options are over there, or who's there. Okay, so I'm assuming they've initiated some work of it, and it sounds like the MRI as well. So we were able to finally we physically went and got the disc. It doesn't talk like that, unfortunately. You have an outpatient MRI with our inpatient system.
Mm-hmm.
So we're working on, and I wish it was easier, getting it uploaded, having our radiologist review it, or just trying to expedite the read of it, because obviously there was a concern, it sounds like, while you were having the imaging done, that there was some more hesitation in the speech or stuttering than before,
Right.
is my understanding? Okay. But of course, they're also not used to you either, so, who knows if that's your usual what's been going on, or if this was really new, it sounds like.
Yeah.
Okay. Did you feel as though when you were getting the MRI done that your speech was more difficult than it has been just the past day?
Oh, yeah.
Okay. Okay. But it seems like there's moments where it's a little bit worse and then a little bit better. Am I understanding this correctly?
Mhm.
Okay. And if I'm wrong, that's what you tell me. I'm just trying to gather
Yeah.
what's going on. Have you had any weakness, numbness, or tingling of the arms or the legs or the face?
In my left leg mainly.
Okay. Tingling or weakness?
Weakness and tingling, yeah.
Okay.
In the
For
lower part.
how long have you noticed that?
For quite a while,
Okay.
yeah.
Okay.
Months.
I had said some.
Is that why you
Okay.
fall? Months?
Huh?
Has it been going on for months?
Oh, yeah.
And that's why part of the reason you end up on the floor?
Yep.
Okay. Is there anything that happened that was new today to you?
Do I now?
So a lot of these things you're telling me it seemed like have been
No.
going on. Is anything new happened today in particular that was new concern?
No.
Not necessarily. Okay. Okay, I'm gathering a lot now. Okay.
Mm-hmm.
I mean, it makes sense. I mean, I'm
Yeah.
hearing, but obviously they
Yeah.
see you for the first time, you're like, my leg is
Right.
tingling,
Yeah.
and my speech is odd. They're
Yeah,
like,
this
ah.
has been.
Okay.
Yeah.
Okay, so,
Yeah.
I'm not a radiologist by any means, so I just glanced really quickly at the MRI, and again, we'll have it truly read by a radiologist who's
Uh-huh.
trained. I'm not trained like that. But it didn't look like there was any obvious abnormalities as far as like a big old mass or a
Yeah.
stroke, but again, I'm not a radiologist, so just sideline there. We'll try to get a formal read expedited to give you hopefully some reassuring information. Okay.
Okay.
But I'm reassured in that it's not sound like you had an acute stroke in that moment on the MRI
No.
table based on what you're telling me.
Yeah.
So that's good. Okay. But it does sound like there's probably some underlying concern of some gradual, memory impairment stuff going on. Unfortunately, that is somewhat to be expected
Yeah.
at your age.
Yeah.
I've seen it happen to a lot of patients
Yeah,
and
I
my
know.
own family members.
Mhm.
Okay, and to what level it's at, that's kind of what you're in the process of being evaluated for. Is it dementia or just age appropriate memory impairment, or is it beyond that? You know, that's what you're trying to really get worked up, it sounds like. So you're doing the right things already. You're already seeing the neurologist, following up with them, trying to get to the bottom of it. Had they done, or have you gone to like a neuropsych for like the full evaluation for like the memory
Yeah.
part of it yet? Okay, but that'll all be part of what they can help lead you through. So, you know, the main focus as far as you coming into the hospital was really that concern of ruling out a stroke,
Right.
really.
Yeah.
But you already did the workup, which was the MRI. You know what I mean? This is backwards of what I'm used to. Usually it's like you come in and you got to get the MRI.
Yeah.
So it's kind of the opposite version, okay? But so we'll kind of follow through, but based on what you're telling me, I'm not hearing that concern from my end medically, okay? Do you take aspirin or anything like that?
I don't take aspirin anymore, no.
No. Okay. Were you taking off it for any particular reason?
No, I would, if I needed something, I would take Tylenol or something
Okay.
like that.
Okay. For like pain. Okay. Have you? When was the last time you did fall?
Just the other day.
Yesterday.
Okay.
I believe it was yesterday you fell.
Do you live at home alone?
No.
No.
Just there.
Husband's there, but he's probably aging as well, right?
Yeah, he's the same age. We're the same age.
Okay.
Yeah.
Are you feeling off balance when you're walking?
Yes.
Okay. Do you ever
Yes.
get like
I don't
dizzy
have
or
good
lightheaded?
balance. Yeah. I cannot stand on one foot and have balance. It's
Well, I can't do that
Forget-
either. One foot. That's pretty good if you can do that. What about 2 feet?
Yeah. How about 2 feet, Mom?
Yeah, I don't know if I can do 1 foot and balance or else. So 2 feet. Are you feeling when you're standing on 2 feet? Are you feeling like wavy or off balance then, or?
no, not like that. But I just,
Give out.
I give out real quick. I can't.
Okay, just like
Yeah,
a weakness and a
yeah.
okay.
Because
When
I can't stand at the kitchen sink and wash dishes
Too long.
completely. You get them everything done.
Okay.
I can't do that.
Why?
If I'll go over there and wash a couple of dishes,
Mhm.
and then I have to sit down.
Okay. Why do you think that is? Do you feel weak? Do you
I'm
feel
not
lightheaded?
Lightheaded, you're getting,
Okay.
almost to get dizzy when I stand up too long
Okay.
in one place.
So I'm going to try to differentiate this a little bit. What I want to understand is it like, and so yeah, just tell me which version this is. But like if you're walking, are you feeling
Uh-huh.
like wobbly off balance? Or are you just feeling like a little woozy lightheaded? Or is it like the room is spinning? Which version of that? So off balance, lightheaded, or dizzy?
More off balance.
Off
Yeah.
balance, okay. I understand.
And some dizziness along with it,
But is it like the room spinning or just like a
No,
woozy?
no,
Okay.
just woozy.
That helps me understand because
Yeah.
when they have the room spinning, that's like a vertigo thing,
Right,
so that's
yeah.
different. Okay, so not vertigo.
No.
Okay. All right. I'm trying to think the best route to take all of this. I don't know necessarily you need to be hospitalized per se. Luckily,
Right,
things
yeah.
are looking okay. Do I think you could benefit from some therapy? Absolutely. Would you be up for like doing therapy at home, where they come to your house and like do therapy with you a couple times a week?
I would be, but my husband would not like
No?
that. No.
Okay.
And going and coming to go to and from to go therapy.
Would be
Well,
harder, or you could do
It
that.
would be harder, yeah.
Okay, that's just why I usually
But-
try to do it at home.
Right, yeah.
We'll,
Why
we'll
would
just
you be
we'll just have
into
to discuss it.
Okay, yeah. So do
And,
discuss
um,
it,
Yeah, with him
please. Yeah.
and see what they want to do. So
Yeah, and we'll check your blood pressure, like when you're
Yeah.
laying, sitting, and standing. Make sure you're not dropping your blood pressure or something. Are you getting easily winded when you're walking or anything like that? Like short of breath or?
Yeah, because it hurts me to walk. I can't walk. I can't walk without a walker.
Okay.
If I do start walking, I can walk maybe from here to Donna and stand straight. But then when I get over that way, I just start curving over. Just start
leaning in. Okay.
leaning,
Like
and
okay.
then by the time I'm up to the table or something, then I'm ready to grab something at the table
Okay.
and hold on.
Okay. Okay. Do you feel short of breath during that
Oh,
time?
yeah.
Is that limiting you?
Yeah.
Okay. Do you feel short of breath when you're just sitting there at rest, or only when you're getting up, moving around?
No, short of breath several times. Yeah.
Okay. When you're sitting there
Lots.
doing nothing.
Right, yeah, sometimes.
Okay,
yeah.
so it comes and goes, it sounds
Yeah.
like. But when you do go to do things, is it making that worse, the breathing? A little bit. Okay, all right. Let me take a listen to you. Any kind of coughing, fevers, chills?
Coughing that's a regular coughing It's
Okay.
been going on.
Were you
here
ever a
for while.
smoker?
No.
Okay, good.
Uh.
Good answer.
No.
We like that. You can just breathe normal right now, okay? All right, if you can, are you able to sit up, or if it's easier, you can kind of roll to your side?
I'm gonna raise up.
Yeah. Try to push it a little. You got it?
Yeah.
All right, deep breath. Blow it out. Again. Excellent. Okay. Good. Last time for me. Good. It's sounding nice and clear. You can lay back. You got it. Okay, do me one more favor. Blow all your air out and just hold it there for just a second. Hold it there. Okay, you can breathe again.
Same thing.
No, you're done. Now listen to your bowel. Your breathing doesn't do anything to the bowel. All right, have you had any other issues? Diarrhea, constipation?
Constipation. Oh.
I'm sorry, I didn't mean to go right to where it hurt you.
No, it might be because I have to go pee.
Okay, it's a little high for a bladder though. Unless you got some weird bladder way up there.
No, there's nothing way up there.
I might
It
have just
be
caught you off
something
guard.
else.
I think I just caught you off guard. Sorry, I should have prepped you maybe a little bit more. Okay, so am I pressing right now bothering you?
Right there, yeah.
Okay, what about over here?
Yeah.
Okay. Here?
No.
Down here?
No.
Okay, that's the bladder. Okay. Any burning when you pee?
No.
Right in there. I got some wincing going on. All right. You said no burning when you pee or anything like that?
No, but yeah, it was yesterday maybe
Yeah.
when I went to go in there and pee. I waited and waited and waited and never came, and then finally it came out.
So a little hesitancy.
Yeah.
Okay. Any
Yeah.
foul smell to the urine?
No,
Okay. Any pink urine or?
not these past few days, but
Okay. Taking your socks off.
in the past recently, I've had like a brownish color to it at times,
Okay.
and then it would change, get a little bit more to the lighter.
Are you hydrating well?
I'm trying to. I usually I drink water all day long, just about.
Okay. Can I see your tongue? Okay. Looks a little dry. How much do you think you're drinking water-wise?
I don't know, a couple bottles of that a day, 2, 3.
Okay. So maybe we could do a little bit more.
Go more?
Yeah.
Okay.
So far, from what I'm hearing.
Yeah.
You know, we'll get an echo of your heart, see how your heart function's looking. I didn't hear any major murmur or anything like that to think there's a valve issue going on to contribute to like the weakness when you're walking or the shortness of breath when you're walking. Your lungs sound clear, your x-ray looked clear of your lungs.
Good.
Like I said, we'll get the MRI as well. We'll watch the heart monitor, make sure no arrhythmias or
Yeah.
anything like that. I heard one extra beat while I was listening, but that's normal
Yeah.
as long as it's not doing it frequently. So we'll get to watch it longer with this, okay? And
What about, was it yesterday morning? Yeah, was it yesterday morning that you got up to go to the bathroom and
Yeah, that's what I felt.
went and
Yeah, in the
you know,
bedroom.
made a mess?
they said it.
I didn't tell you about that, did I?
No.
Maybe not. Tell me what she's saying.
Yeah, go ahead and tell her about,
It's
because Ron was supposed to take you to the doctor yesterday, remember that?
Right, yeah.
And then,
Um,
you went to the bathroom and you had been constipated apparently,
yes.
and what, do you
Was
remember?
was she like trying to bear down to have a bowel movement maybe?
You remember about that?
no.
Remember that?
No.
And,
I
you
was
y'all
sticking
called
to it.
Rhonda and told her don't worry about it, and then Reba took you to wherever it was you was going.
Oh, yeah, she took me to the,
But you had made a mess and she was bleeding.
But she was bleeding?
You'd gone to the bathroom, and you had been constipated apparently, and you had gone to the bathroom and was bleeding, and
oh, that was about a week ago.
no, in Daddy's bathroom yesterday morning. Yeah.
Yesterday.
Okay, so we'll get into that maybe a little bit. Let's go back to the poop and then we'll get into the bleed thing. And obviously maybe there's some memory mismatch there. We'll see.
Yeah.
All right, so when was your last bowel movement? Was this yesterday perhaps?
No, uh-uh.
No, that's not what you're
Let's
thinking,
see,
okay.
At least 3 days ago.
Okay, and are you having a strain and is it hard?
Oh, gosh, it was so hard.
Yeah. Are you taking anything to help with the bowel movements?
I will be shortly. I have I haven't at home yet.
Yeah, we'll be giving it to you here probably, it
Yeah.
sounds like. Okay.
I
And
took,
then-
I took the Miralax, and so far that has not worked.
Okay.
You know, and that was yesterday morning or the day
Okay.
before.
Yeah, we might need to give you a little fluids with that to work a little bit better.
Okay.
It's all about like it absorbing water, and if you're not really
Yeah.
having enough water in your system, there's not a lot to absorb away from
Yeah.
it. Yeah. I mean,
I know a
the
couple of
little
days,
dry.
last week sometime, that I had gone, and it hurt so bad when it came out.
Yeah.
And, I mean, before I flushed the toilet, I picked it some, got some fresh toilet paper and reached down in there and picked up one, and it was as hard as it could be.
Yeah.
It was like a rock.
Okay. Are you doing any kind of like Metamucil or fiber supplementation?
No, I don't like the Metamucil, but I've got the Miralax that I use if I need
Okay.
it,
Okay.
and I just haven't been using it
Okay.
enough.
Now, did you see blood in your stool? Whether it was bright red or black?
No. But sometimes when I am, you know, having a movement, if it feels real hard and hurts, well, then I will look in the toilet,
Yeah.
and then there will be some blood there.
Okay, what about like on the toilet paper when you wipe? Is it on a little bit of blood
Yeah,
there too?
a
Okay.
little bit.
And when you say it's in the toilet, are you saying like the toilet bowl is full or like
Oh,
little
no,
streaks
it's not
of
full.
blood kind of
It's
on the?
just a little bit.
Okay.
You know, a little bit
And
of redness to the
Do you have any hemorrhoids that you know of?
Not that I know
Okay, well you probably
of. I've never
could,
been
yeah.
checked for that.
Yeah, I know. I always ask that question. Some people know for sure, but other people that have no idea because it's not unless you really know. I don't want to check myself personally to know if I have them, but if you're prone to constipation and straining a lot, the odds are you probably do have some.
It's
hemorrhoids,
not
but
something that you talk about.
Exactly.
That's why I said,
Nor is it something you're digging around to find sometimes either.
This is just eyes. and
So what is
some
the story you understand from yesterday's bowel movement?
That's good,
I
thank
know
you.
you can't eat, we're just gonna move this closer.
apparently
Thank
she made a mess,
Mm-hmm.
and it was so bad that my dad couldn't go in the bathroom.
Or like diarrhea kind of mess, or just like poop was just everywhere?
I don't understand why.
Yeah.
But apparently, we had to get somebody to clean it up. But,
Interesting.
yeah, I don't know how in the world it could have gotten everywhere. I haven't
Yeah.
spoken to my dad about it.
She doesn't have
It's
fresh
just
of
eyes
it, yeah.
first start.
So, and I have
But
told
your
her about
diet tray
Miralax.
will be around 4
And this
months
way, good or bad, or-
Months ago, I told
Within
her
an hour or
take
so,
it.
it's not here, let me
But-
know.
I do it
Thank you.
almost
Yeah.
every day.
With some water.
Juice, whatever.
Yeah, something.
And depending on what medicine I am taking, it happens to me. I understand it now because I've been through it and I've had to sort of research the whole thing. She needs to be doing some of this stuff every day,
Yeah.
But you can see that the issue yesterday morning.
Now, before you get too excited, I wanted to do one more thing with you.
Okay.
We'll hook you up.
Yesterday morning, there was the bathroom situation, and so that did happen yesterday morning.
Okay.
Um,
Yeah. Okay.
So I doubt she might not have been to the bathroom since yesterday morning.
Yeah, but maybe it sounds like there was quite a bit. Maybe yesterday. Yeah. Okay. Here, do a few things with me real quick. Okay. Smile. Good. Raise your eyebrows. Nice. Stick out the tongue again. I'm looking at something different. Good. Shrug your shoulders up.
Don't touch this one too hard. This
Okay.
is where
I have to put a little.
whatever I hit right
Okay,
there.
I put a little weight on it, but if you can just shrug up for me like you're, yeah, that's all I need to see. I just need to feel the strength. Good. Sorry about that.
It's okay.
Squeeze. Pull me towards you if you can. Good. Push it away. Okay, the strength is pretty good there. Hold your arms out like this for me. Flip upside down. Like you're holding two bowls. Close your eyes and try to keep those two bowls up. Close your eyes. Good. Relax. All right, you got some arthritis, girl. All right,
Yeah,
relax. Relax. She's like, yes, I know that. Thank you for pointing that out. You're welcome. Sorry, I just noticed your fingers are a little crooked. All right, lift that leg back up for me. Hold it up for me if you can. I'm going to push down against you. See how strong you are. Okay, push down against my hand. Good. Same thing up. You got it. I'm going to push down. Is that hurting you?
Yeah, it hurts all the way up into
Okay,
the thigh.
push down. Okay, good. So it looks like it was a little more weak just from the pain. I'm sorry. All right, push on my hand with your toes like you're slamming on the brakes of the car. Good. Okay, good. You did good on that one. And toes up. Okay, there we go. Okay, good. I'm working you out. When I touch you, does it feel the same or different on both sides?
A little stronger in this hand.
Okay, here.
Okay.
Any lower back pain or anything
Yes,
like that?
yes.
Yeah. Okay, I'm kind of gathering that a little
I've
bit.
had 3 back surgeries.
Okay.
You got all kinds of surgeries, Mom.
I know it. Oh,
A little tender in the hip.
Yeah, right there,
Okay.
yeah.
When
There's
did you
a-
fall? Did you fall yesterday? Yesterday.
Yesterday.
You fell yesterday.
Yeah.
You ready? You're gonna hit me more now. I'm gonna try to move your hip
There's
a
a
little bit.
spot, right.
Yeah, I
It's a
felt
little
that.
hard spot.
Oh,
It's
okay.
like a little round hard spot up in there
Okay,
somewhere.
move your fingers real quick.
Just keep pressing around and you'll feel it. It's in that area right there, down maybe just a little bit lower. I mean, towards this way. Towards the front.
I don't think I'm hitting what you're saying. I'm trying to see if I feel it, but okay, I'm not hitting it, huh? I don't
right,
feel
right
it.
there, right there. Somewhere right there,
Oh,
yeah.
that's right on your hip.
Yeah.
Okay, but I don't feel, I guess, a additional abnormality per
Yeah,
se.
it feels different from.
Okay, I'm just gonna tuck this a little bit between your legs so I don't flash people.
I got mine where else.
Oh, you do?
Yeah,
Okay.
hair.
I never know what's gonna happen. Okay, so knee bend a little bit for me.
Which way?
Well, you can't go the other way, I don't think. All right, right there. Okay, how does that feel in the hip? Are you doing okay?
It's a little bit sore.
Okay, are you able to point that knee that way? Okay. There you go, you did good.
Okay.
Pull back in. Good. Okay, relax, yeah. Good job. Alright, so I do wonder if some of that like pain that you're having from the leg and the tingling could be
Uh-huh.
coming more from the back.
Could be from the back. Yeah, I never
Yeah.
thought about that. And
Yeah, and I'm sure you have a little arthritis in that hip too.
Yeah.
But you're moving it well, so that's good. Okay?
Right.
Alright. Yeah, so neurologically
Yeah.
you're seeing pretty good. I mean,
Sunday
What?
was Mother's Day.
Yeah.
We went to eat. Remember that?
Yeah.
Then we left IHOP. Remember that?
Yeah.
And we went. Where'd we go?
We went to the movie.
Okay. Do you remember? You remember getting in there? Getting into the movie theater?
Into the theater.
Mhm.
Yeah.
How?
How?
How'd you get in there?
I had my walker with me.
Yeah, she walked in there.
Okay.
With her walker.
good.
And then what did we watch? You remember what movie we watched?
Fried green tomatoes.
Yeah. Okay. Did you
Good.
like it?
Yeah.
Yeah.
Loved it.
It's a good movie.
My second time.
Okay. Okay.
She's quizzing you.
And then
Did she pass?
and then what?
And then we left there and went home.
Who took you home?
You wouldn't pour this over the ice cream.
Yeah, thank you. Rhonda did.
Rhonda. Okay.
Yeah.
Okay. Anything else?
Just something happened.
You didn't fall that day.
No.
I think it might have been Monday and Tuesday. What is today? Today's Friday.
No.
You fell like
I feel it.
twice, at least 2 days this week.
Yeah.
Anyway.
Yeah.
Okay, so I do think she would benefit quite a bit from therapy. So do talk about the therapy at home as an option, okay? All right, we'll go from there. I'll see if I can get a therapist to see you here and that as well.
Yeah.
Okay. All right, thank you guys.